The target in clinical diagnostic tool, endocrine and Inborn era. Endocrine gland distribution, protein hormone, hypothalamus, pituitary gland, thyroid, thyroid hormone, inflammatory metabolism to carbohydrate disorder, lipid disorder, amino acid disorder, nucleic disorder. Endocrine system. The body endocrine system consists of the tissue, mainly gland that release the hormones. The hormone chemicals that coordinate different functions where body, hair and muscles, through where organs, skin, muscle, other tissue. The hormones are essential for life of health. The gland releases specific hormones of your bloodstream. Hormone travel through the blood to the other cell to help control or coordinate any body process. Endocrine glands include adrenal gland, hypothalamus, gland, pancreas, ovaries, parathyroid. Adrenal gland, two glands at the top of kidney that release a hormone, cortisol. Hypothalamus, middle brain, neutral pituitary gland that release a hormone, gland, pancreas. Pancreas control release of hormones, insulin, and glucagon. Ovaries, female reproduction except produces sex hormone. Parathyroid, ovarian gland, nectar role of the bone development. Pineal gland located in the center of the brain, the male linked sleep pattern. Pituitary gland, which supplies the brain into inflation the other gland, especially the thyroid. The problem with pituitary gland, bone growth, bone menstrual cycle, and the release of breast milk. The male production gland is that regular sperm and sex hormone. Thymus, upper just that help to develop the body immune system early life. Thyroid, butterfly shaped the gland from the neck that control the metabolism. Endocrine gland disorder cases. The result is the gland produces much too little endocrine hormone called the hormone imbalance. Development illustration endocrine system affects of level endocrine disease. Symptoms in endocrine disorder: change in heart rate, change in skin or eye, bone fracture, high blood sugar level, high calcium level, low high blood pressure, unexplained change in your weight, loss of sex drive, infertility, menstrual cycle disorder. Endocrine disturbances. The hypothalamus pituitary thyroid assets create pathway metabolic and functional issues. Hypothyroidism, hypothyroidism causes symptom, additional disease, growth deficiency of and diabetes. Hypothalamus pituitary master regulator protein hormone release will the target plant managing metabolic and thyroid hormone production. The hypothalamus protein page hormone include TRH, GnRH, CRH, CHRH, somatotropin, and dopamine. Hypothalamus protein hormone function. TRH stimulation thyroid hormone, TH prolactin, gonadotrophic release hormones, the leucine hormones, LH regulatory reproduction function, corticotropin release hormone, regulator metabolism stress response, growth hormone release promoter stimulation or growth secretion, tomatosterone insufficient release, dopamine insufficient release of prolactin, oxidation variprin, pituitary for labor lactation, water retention, and blood pressure regulation. Adrenal pituitary prefecture of hypothalamus release hormones, neurosecretory cells. Its hypothalamus, infundibulum, pituitary gland, anterior pituitary gland, hypothalamus, portal vein, superior artery. Mechanics of action. Hypothalamus prepared signal for metabolic G protein populated expected triggers intracellular signal. Role of metabolism. The pathology CRB chromatostrain and the effect of release CH. Hormone include amino acid update protein deposition itself. Internal part of the central nervous system, regulator process in endocrine system, regarded the organ in lymphatic system. Located under thalamus above the pituitary gland. Hypothalamus controls body temperature. In the control system is regulated pituitary gland. Master gland is body. Hypothalamus disorder. Hormones needed secretion of glutamate level. Very or low secretion of lead to hypothalamic disorder. Hypothalamic disorder can be due to following problem: heart infection, genetic disorder, tumors and thalamus, disorder of eating, brain surgery, autoimmune system disorder. Symptom including hypothalamic disorder, body temperature, inflation, insomnia, change of appetite, frequency urination, delayed pituitary gland discharge protein. Pituitary gland regulated that hypothalamus acts as a master gland. Hyperpituitarinemias often the cause of tumors, carcinoma, across hormone. Hyperpituitation and substitution low growth of hormone. Hyperpituitism deficiency of pituitary hormone. Posterior pituitary gland, anterior hormone ATH. Thyroid distributed thyroid hormone. The hormone is tyrosine to adenosine production under the influence TSH from pituitary. Hypothyroidism, excess thyroid hormone, increases metabolism, resulting in weight loss, rapid heartbeat, and anxiety. Hypothyroidism influences hormone flow, metabolism resulting in fatigue, weight gain, and goal intolerance. Thyroid hormone disturbance, adrenal reproduction. The thyroid hormone regulates cholesterol reproduction, adrenal cortex, and gonad. Addition disease to low aldosterone and insufficient fatigue, weight loss and blood pressure, reproduction thyroid, estrogen, testosterone, polycystic ovary syndrome involving PCOS, androgen SS, low level of low infertility. Common symptoms: endocrine, the metabolic concept weight, increase appetite, skin care, thinking care, again and dry skin. Reproductive regulated menstrual cycle, inflatates are low, infant metabolism, IEM, the signal and diffusion clinically, black metabolism resulting in accumulation and separate began black sufficiency product. Metabolic part of the food, breakdown to blood and is a catch of feed range of symptoms. Cerebral infant metabolism, catch of development, problem to not controlled. IEM defined by the clinical research for quick chemistry affected their pattern of in cardiac. Basic concept metabolic pathway, specific chemistry, gene mutation, deficiency of absence of chemistry. Accumulate toxic substance, deficiency of essential products, alternative harmful pathway activation. Type of EME, cardiology, metabolic disorder, amino acid disorder, lipid metabolic disorder, nucleic. Mediation of infant metabolism, glucose solution, insulin, sodium pentate, sodium phenolate, amino supplement, enzyme replacement, dietary supplement. The EME and included infant metabolism. Carbohydrate metabolism disorder. Carbohydrate metabolism disorder were prevented properly liver dysfunction and energy failure. include galactosemia, glucogen storage disease, down to stored sugar, CPT deficiency, red blood cell dysfunction, and diabetes. Carbohydrate disorder called galactosemia, the metabolism implanted into metabolic galactose, the compound of lactose and milk. The blood cannot break down galactose, lactose milk, catching them toxic protein. Autosomal recessive condition, often diagnosed as Inborn green. The essential untreated classical galactosemia fetal within the week birth due to severe liver, brain and kidney damage. Symptoms: the liver failure, jaundice, speaking cataracts, intolerant epilepsy. Treatment is strict lactose and free diet immediately after the birth. Glycotoxicity. Symptoms of liver enlargement type include pancreatic and thyroid, frequent splitting of the managed by hypovolemia. Glucose phosphate dehydrogenase deficiency. The hemolysis level is phosphorus by trigger like pain, infection of greater medicinate. X-linked genetic disorder. Symptoms: CCP deficiency, astrometric hemolytic diabetes, red blood cell, jaundice, yellow skin and diseased eye, particularly common in plantar symptoms: anemia, dark urine often disordered, dark cholera, diabetes, heart rate of shortness, breakthrough. Hypervolemia condition characterized by blood sugar glucose level 70 mg/dl. Intimate treatment involving some 15 gram fasting actin. Psychiatric hypovolemia, diabetic medication overdose, the insulin over diabetic medicine, lifestyle factor keeping the fasting against alternative. Physical activity increase the physical activity without adjustment food intake the medicine. Alcohol consumption, alcohol without food, other potential causes over kidney failure tumors. High volume tracker. The goal of rate of blood sugar limited. The fate of 50 minutes check of blood sugar. Receptive of 70 mg/dl respective process. Once normal of small snake prevent the second trap. Common symptoms of hypovolemia, certain hunger, fatigue, and anastic, rapid heart rate, lack of concentration. Diabetes mellitus disorder when called metabolism deficiency hyperkalemia, autoimmune resistance to insulin. Autoimmune disorder pancreatic beta type of 1 insulin resistant linked life factor type 2. Steroid frequency urination, sexual blindness, weight loss, and fatigue. Pediatric factors include genetic predisposition, overweight of person, physical and main cause. The one type of diabetes, two type of diabetes, cat food type 1 diabetes body immune system mistakenly attacks the disorder insulin production beta in pancreas. The body develops resistance insulin, pancreas cannot produce catch up to overcome resistance. Gastrinal diabetes, change of during the pregnancy of calcium. Symptoms: polyuria, polydyspepsia, encephalin, increase of hunger, fatigue and flu. Diabetes mellitus, pancreas damage, the beta alpha beta glucose results in not accepting insulin. Stage 1, stage 2, stage 3, long standing. Symptoms of diabetes adult children. Excessive hunger, unexplained weight loss, random vision, vaginal yeast infection, frequency influence, lipid disorder. Lipid disorder to develop substantial blood cholesterol, triglycerides, higher risk of developing cardiovascular disease, heart attack, stroke. HDL cholesterol also has a higher risk of heart attack and stroke. In additional purpose, very highly level of triglyceride are is developing inflammation and pancreas called pancreatitis. Dysautonomia. The autosomal lipid protein disorder causes of genetic mutation the preventer from taking to substantial leading to toxic accumulation, cerebral neurodegeneration, early death. Causes mutation HCF catching deficiency MC beta histosumidin breaks in HCMT gynecologic nervous cell. Symptoms 6 months executive response of motor skill, blindness, executive characteristics carrying. Niemann Pickett disease. The gene mutation acid symptomatic deficient leading to pancreatic blood club. Type C is caused by NPCA11 and NPC2 mutation affecting cholesterol transport. Symptoms: the liver and plain visceral disease, neurodegeneration, attention, accelerated, and dementia. Diagnosis system aside genetic testing used a diagnosis path condition, but disease significant neurodegeneration, the carried red blood macula. Amino acid disorder. Alkaloidurium mobile syrup increasing metabolic where body cannot properly break down amino acid catching toxic protein, leading to life-threatening issues including cerebral neurological damage or chronic system effects. Managing properly data monitor. Pulmonary KU cancers affect pulmonary prevent breakdown of pulmonary include disability, behavioral use of mustard odor, low mineral of diet, MSUT, the branches amino of silicon isolate deficiency of distinct makeup syrup or odor of urine fat. Without immunity treatment, the cause of brain damage, death of weight. Alkopetonuria, hemogenic saturation leading to accumulation of genetic black pigment accumulation in connective tissue. Then the problem automatic and urine and the black and exposure. Nucleotide disorder is genetic metabolic condition of the supplemented synthesis. DNA repair pathway. The Lec-5 symptoms called overridden acidic DNA repair deficit like symptoms. Purine metabolism and predominant metabolism. Purine metabolism adenoguanine, predominant metabolism cytosine, thiamine, uracil. Lack of oxygen syndrome. Near complete frequency, HRP, MCM. Symptoms in hyperkinemia, neurological behavior. The multinucleation fingerprinting at bank. Management no infant alpha-nuclear uric acid behavior management to the prevent the self-injury. Premature metabolism disorder, overrun acetonuria, deficit of synthesis, UMP formation, facial megaloplastic anemia, growth deterioration, excessive overrunning acid curing. Purine metabolism disorder, deficiency HCPRT, MCM lead to uric acid, fetal mental retardation, self-mutilation between lip finger, the big leg symptom B, cold, cases, uric acid, hyperthermia, joint pain, escapably big and uric acid fetal deposit. Quote, the result of excess of uric acid will have NLH, especially serve of this condition. Secondly, the high volume uric acid production of urine overproduction due to the lack of catch of acetic acid deposit and joint to coating at the kidney. Diagnosis high uric acid level blood and urine. Genetic test and mutation in the HPRT1 gene. Measurement of HPRT enzyme activated in cell.